pharmacological treatment of the reproductive cycle in cattle. So prostaglandin treatment, such as dinoprost, which is natural, or cloprostanol, is used for shortening the luteal phase, so luteolysis, which is used for estrus synchronization. The prostaglandins regulate luteolysis. So in the non-pregnant uterus, PGF2 alpha in the endometrium goes to the corpus luteum and induces luteolysis. And then the caudal part of the pituitary allows oxytocin to be released, and then oxytocin goes to the endometrium and causes more PGF2 alpha secretion. So in veterinary application, prostaglandins such as PGF2 alpha, if they're injected, they will induce luteolysis, and this will shorten the luteal phase. This allows us to synchronize cows for estrus. And for GnRH treatment, we use deslorelin. This induces ovulation. It's used to synchronize a large number of animals at once. So GnRH secretion will cause follicles to increase by FSH increasing. So then when the follicles become mature, then estrogen threshold will increase. This E2 increase will cause an LH peak, and the LH peak will cause ovulation. There will be no ovulation if P4 progesterone is high. For veterinary application, if you combine with a progesterone sponge, this will cause follicle stimulating hormone to increase, which will help synchronize the animals. And when you give the GnRH injection after luteolysis, this will induce ovulation at the same time, so you can inseminate them all at the same time. For progestogen treatment, so this is the P4 effect, which is progesterone. This stops follicular development and it helps develop the corpus luteum. For veterinary application, the intravaginal sponge allows us to make sure the cow stays in the luteal phase. It also helps the cow to go into the luteal phase. This is done to induce luteolysis for synchronization. So we have 4 different protocols: OVSync 56, double OVSync, 5-day protocol, and the 7-day protocol. OVSync 56 involves 1 GnRH injection, followed by a PGF injection, followed by a second GnRH injection, and then a timed AI. For the first GnRH injection, if you give it when the animal is ready to ovulate, it will induce ovulation and then a corpus luteum will form. If the animal is not ready to ovulate, it'll cause the follicle to increase. The animal might ovulate, but there will be no time for a corpus luteum. So at 7 days, the ones that ovulated at injection will have a corpus luteum, but not the ones that did not ovulate at the time of injection. So 7 days after the GnRH injection, they're given a PGF injection. This is to allow luteolysis. It destroys the corpus luteum. And then 56 hours the PGF injection, you give the second GnRH injection. This will induce synchronized ovulation, even with those that ovulated just after the first GnRH injection. Then we can do a timed artificial insemination, 16 hours after the second GnRH injection. However, this can lead to a lot of missed cows. Next protocol, or method, is the double OVSync. This allows the AI technician to catch more cows and to make sure all the cows are synchronized. However, it takes over 3 weeks. So you have the first injection of GnRH, and then you give PGF after 7 days, and then after 3 days you give GnRH again, and then after 7 days again you give GnRH, and then after another 7 days you give PGF. And then after 56 hours, you give GnRH again, and then after 16 hours, you give timed artificial insemination. For the 5-day protocol, you give GnRH injection, and then you put in a progesterone sponge, also known as PRID5D. So when the animal is ready to ovulate, it ovulates, and then the corpus luteum develops. And then the stasis happens in the corpus luteum. And if an animal is not ready to ovulate, follicular stimulation happens, which then develops a corpus luteum. And then you give the first PGF injection, which induces luteolysis. And then after 24 hours, you give another PGF injection. This causes luteolysis to the rest of them. Then we do the second GnRH injection, and then a timed artificial insemination, 48 hours after.